The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Good evening friends, we are back with yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Anupama Menon. Your health is our concern. In this talk show Health World, we have expert doctors from various fields providing valuable information on various medical topics so that you can keep diseases at bay and enjoy good health. Pregnancy is one of the most beautiful phases of a woman's life. The feeling of having another life within you, the joy and excitement of nurturing and nourishing a life and bringing it into the world as your own child, it is truly a blessing. All the expectant mothers have only one wish, to have a healthy child. And so, pregnancy comes with its own share of responsibilities. It's very important that expectant mothers take care of their own health because at the end of the day, the mother's health greatly impacts the health of the unborn child. Gestational hypertension is one of the major problems faced by many expectant mothers. So to throw more light on this topic, today we are joined by Dr. Deepthi Hunsur Ramesh, specialist obstetrician and gynecologist from Al Hilal Hospital, Hamad Town. She has an experience of over 10 years in the field of gynecology. So let's go over to her and know more about the problem of gestational hypertension. Doctor?
Hi.
Good evening. How are you
Good
doing
evening
today?
all. Yeah, fine. Thank you. How are you?
I'm fine, doctor, and thank you for
Yeah.
joining us.
Sure. Thank you.
So as we mentioned earlier, gestational hypertension is a major health concern for pregnant mothers.
Yes.
So how would you describe this in medical terms?
Actually, gestational hypertension, as the name tells, gestation means the pregnancy and the hypertension is the high BP
High BP.
recordings. So, it is like the development of high BP recordings in pregnancy, which is diagnosed after 20 weeks of gestation, or to say in lay terms, it is after 5 months of pregnancy. So, we get a high BP recordings after 20 weeks of gestation. So, this is known as gestational hypertension, and this is a major concern for us now.
So why is it important that we need to know about this? Why is it an awareness about this important?
Actually, the thing is, there is a set of hypertensive disorders, not alone gestational hypertension, but other types of hypertension disorders in pregnancy. They account for 8 to 10% of affecting the mothers to be in the population worldwide, and gestational hypertension alone accounts for around 6% of these women. So, that is why it is quite huge percentage.
Yes.
And the one more thing is, the hypertension in the women, as you said, it affects the baby inside also. So, it will be concerned both with the mother and the baby. So, it is definitely a point of concern.
So, what are the symptoms that are normally observed in a mother, expectant mother having hypertension?
Yeah,
because in the normal cases, we know that we could get a headache or feeling dizzy. Is it the same for pregnant women as well?
Not completely, but a few symptoms are similar as other hypertensions. But as I said, it affects pregnant women in a different way. So, once the women passes, like finishes her 20th week or 5 months of pregnancy, we get a BP recordings of more than 140 by 90. That is what the upper end is 140, more than 140, and the diastolic BP, the lower one is more than 90 millimeters of mercury. We call it as a gestational hypertension. Not alone one thing, it should be like 2 episodes, like 2 BP recordings of more than 140/90 at least 4 hours apart. So, this is when we call it as a gestational hypertension, and usually when the women comes for a regular ANC checkup, we keep. So, our examination starts with her vitals first. So, her BP recordings of more than 140/90, as I said before, on 2 recordings. So, we will claim her as a gestational hypertensive mother. Apart from this, mother will be having swelling of the legs, or she will be having sudden weight gain. Usually the normal weight gain is around 1 pound per week. So, every month checkup we will have like 4 pounds per month. If it is suddenly like maybe like 6-7 pounds, then it alarms the presence of a gestational hypertension. And if this is like still more complicated, that means hypertension she might have developed, not taken care, or not taken a proper regular ANC, or not detected in the early gestational time. So, it will progress to other complications. Then she may have like blurring of vision, as you said, dizziness, then pedal edema, edema in her legs, then in the face, okay, and she may have pain in her epigastric region, that is upper part of your stomach she has.
Okay, because of hypertension there could be pain
and these are the complications of hypertension. Then maybe I can coin the term of preeclampsia. So, that means the urine is less, that is the passage of urine amount what she passes usually, it gets reduced as the kidneys are also affected. Then she may have the next other complications like pain, as I said, epigastric pain. This is because of affecting the liver, okay, and then dizziness, blurring of vision, double visions. That is because all the blood vessels in the retina, that means the eye, even that gets affected due to the hypertension.
So, hypertension can basically affect almost every
organ. Every organ. This is I am telling about the mothers. Yeah, but it also affects the uterus and the baby within. So, it may cause preterm deliveries, and it may affect the baby's growth inside. So, baby will be rather small than the other normal pregnant women, and it can cause abruption, like this is condition where the placenta is separated before the childbirth inside.
And that could happen because of hypertension?
Hypertension, yes. That is what happens is it gets separated. So, that means the contact between the mother and the baby is lost.
Broken.
So, that will lead to intrauterine fetal death also. So, these are the complications.
So, a lot of
may
major
come.
health
Yeah,
complications for the
serious,
mother
yeah,
and the child. So, I think all the expectant mothers, what they have to look out for is swelling in their feet,
Yes.
sudden weight
Sudden
gain,
weight gain, yes.
and maybe dizziness, blurring of vision. So, if
Sure,
they
sure.
see any of these symptoms, I think they should not delay further and
Yeah,
maybe, you know,
Absolutely,
rather than wait
absolutely.
for the regular checkup, I think they should visit
Yeah.
the doctor and get a checkup
Yeah,
done.
many people they come with pedal like have edema in her legs, but the main thing which differentiates it from the normal physiological edema is that when she takes rest over the night, the normal physiological edema will go down.
Okay.
There won't be there in the early morning, but as she works in the kitchen or she goes out for work, as the day progresses it will come. That is because of the gravid pregnant uterus it happens. That is because of, that is physiological. But even after taking rest, the edema in her legs, that doesn't subside, that does not reduce. That means it is something like pathological.
So, that is a difference between the normal physiological edema
yes.
and one which is caused by hypertension.
Hypertension,
So,
yeah,
even with rest, even after night's sleep, if the edema,
Yes,
the
yes.
swelling doesn't subside,
Yes.
then that means it is because of
Yes,
hypertension.
And they usually come with puffiness of the
In the
face,
face,
also.
yes.
That is one predominant symptom which the family members make out.
Yes.
So, that is also one of the things. So, these are called as the warning symptoms. So, whenever we see a hypertensive mother or a gestational hypertension mother, we have to warn them with all these symptoms also. So, anytime they develop all these things, please do not delay, just seek the medical advice as soon as possible.
And what are some of the other hypertensive disorders other than this?
So, cumulatively we have other 3 to 4 types of hypertensive disorders. So, one is the gestational hypertension, which I said, that is diagnosed usually in the pregnancy after 20 weeks of pregnancy, and usually this subsides once the delivery is done. So, it usually takes 2 to 3 weeks or maximum 12 weeks. So, it will resolve, she will become a normotensive once the baby is delivered.
Okay.
So, this is the criteria for gestational hypertension. So, this gestational hypertension along with proteinuria, that means excreting protein in her urine. So, we will be having protein or albumin presence in her urine test. So, that gives to the rise of preeclampsia. So, hypertension plus proteinuria is preeclampsia. Next stage, when the preeclampsia is also not controlled or taken care, that will lead to eclampsia. That is, eclampsia means along with preeclampsia, the women throws a seizures, convulsions.
Seizures, okay.
So, that is when the blood vessels in the brains are also affected. So, they will throw a convulsion or a seizure. So, that is known as eclampsia. So, apart from that, we have a chronic hypertension in pregnancy. That is, if it is diagnosed before 20 weeks of gestation, or she is already hypertensive before becoming pregnant, or if the hypertension is residual, that means the hypertension is not going down even after 12 weeks of delivery. So, these are where we have the condition or coin the term as chronic hypertension. So, these are the major types of the hypertensive disorders.
Different kinds of hypertensive disorders. So, if left untreated, this can lead to major complications.
Yeah, major complication. One almost as we discussed, one more is the HELP syndrome, where it is like hemolysis, even the blood vessel starts disintegrating in the mother's thing, and she will start bleeding. Okay. Then there is low platelet count. So, this leads to the clotting factors are altered. So, when a woman or when any person gets a wound, the blood will clot and seal the wound, but that does not happen when these things happen, and there will be liver function tests deranged. So, raising liver functions or the raising enzymes of the livers. So, this is known as HELP. So, these are the complications if the hypertension in pregnancy are not treated.
So, what causes these conditions? Is there any specific cause for this? Is it hereditary, or is it because of a lifestyle or diet? What exactly causes?
Genetically, yes, it is proven, but not the major complete etiopathogenesis, that is what the pathology is not completely understood. But the major thing is the abnormal placentation. So what happens when there is placentation, implantation and placentation of the pregnancy? The spiral arteries in the uterus, they are converted into huge wide vessels. So that means the blood flow easily to the baby. That is how it happens. But what happens in a hypertension disorder? This doesn't occur. So there is high resistant vessels. That means blood has to take its power to push through the blood vessels to reach the baby. So this is the major things happen. This is one of the major causes. The other things are many interleukins and the dilating factors are not there, restrictive factors all are there. But not everything cannot be attributed only to this one. There are many, but this is the major cause.
And how is it diagnosed? You said after 20 weeks a
Yes.
normal reading is taken,
Yeah.
and if it's more than 2 episodes in one
Yeah,
day.
yeah.
And are there any other ways to diagnose it? Any tests that you would normally recommend?
Yeah, usually that blood test. So once the BP recordings are high on 2 recordings, we want to be sure whether it is just a gestational hypertension or any other complication of gestational hypertension. So we do a renal function test or the kidney function test to see the creatinine and the proteinuria, then liver function test to assess the liver enzymes, and the coagulation test to see how the blood clotting factors are. So all these things will tell us the severity of the disease, whether they are just a gestational hypertension or something more.
Something more to be worried about. And which is the category which is more prone to getting this? I mean, risk factors. What are the kind of risk factors that we should take into account?
So one, there are many risk factors. To name them as like early preemies, that means teenage pregnancies, who are less than 20 years of age, and elderly who are more than 40 years. Okay, so these, and who had their previous delivery or previous pregnancy affected by hypertension. Okay, so or one who already have other medical disorders like maybe diabetes, maybe they have already got gestational diabetes, that is pregnancy induced diabetes in pregnancy. So if these medical disorders are already there, they are more prone to develop gestational hypertension. And other systemic lupus erythematosus, these are the immune disorders, and the women who already has some kidney disease, and ethnicity like black ethnicity, especially sub-African country women. Okay, and ART, that is artificial reproductive techniques women who have become pregnant after IVF. Yes. So these are the women who are more prone, and the women who are having multifetal gestation, twins, triplets. So because we know the pathology is in the placentation, so bigger the placentation, more is the risk factor. So multifetal gestation. So these are the enumerate few of the risk factors we see. So whenever the women comes with these risk factors, we should be like
they should be observing, monitored
them.
So doctor, what are the preventive measures that we can take, to avoid this condition?
So actually the thing is, gestational hypertension is not preventable, but yeah, definitely the complications are preventable. So mainly usually we tell them to the risk factors. So I told you, the women who are at risk for developing, so you should counsel them regarding all these symptoms and the warning symptoms.
So they are more aware and alert about
they
the
know
changes
what
in
to
the
do
body.
and when to come to us.
Yes.
Okay, then with that, they should be advised to take low sodium diet, low salt, that is less than 5 grams per day. Take lots of vegetables and fruits, and this trans carbs and saturated fats they have to reduce. And women who are addicted to smoking and alcohol, either they should reduce or preferably stop during the pregnancies. And regular physical workout exercises and adequate sleep, minimum 8 hours, that is what we tell. And managing stress, the most important factor nowadays.
I think during pregnancy it's very important for the expectant mothers to be in a good frame of mind. I think
seriously, and that too with all work, the household and the outside external work, it is quite a stress factor. So we usually better to counsel them and along with their family members.
I think she also needs a lot of support, tender, loving care from her family, from her husband. That goes a long way in alleviating stress also.
Yeah, definitely. So this is how we have to take care of her, start counseling her from the beginning, take off the risk factors, whether she is definitely a risk factor or not. So then high risk, that's what we call it as a high risk pregnancy. So we take all the risk factors into consideration, counsel them, counsel the attenders also and the patient whom she stays along with them for the more period, like maybe husband or a mother or a sister, whoever. So even in the workplace, better she has a stress-free life
environment.
So that is the best thing, we can prevent the complications of this.
Okay. So in the dietary changes, low sodium diet,
Yes.
And more of vegetables,
Yes.
and some sort of exercise, good sleep,
Yeah.
and a stress-free environment.
Yes, definitely.
Yeah. And how was it managed in medical terms? Once a patient has been diagnosed with gestational hypertension, what is the course of treatment?
So as I said, the treatment will depend on the severity. So if it is just a gestational hypertension, that will be categorized as a mild and a severe form. So mild if it is more than 140, less than 159 in the systolic blood pressure, and diastolic blood pressure from 90 to 99. So this category women can be treated on oral hypertensive medications which are safer in pregnancies. So we do advise them the antihypertensive treatment, but with regular monitoring, maybe monitoring in alternate day or BP monitoring. We do call it as a home monitoring. So ask them to buy a home BP machine,
apparatus at home,
yeah, they can just monitor and they can report to us when if it is going more than that, the stipulated ranges of
That
blood
is
pressure.
140 and 90.
Yeah,
right?
140,
That's beyond
90.
that, huh.
From 140 to 159 we can give a gap, that
Okay.
rate, that is mild. So if it is more than 160, then she cannot be managed on a OPD basis or a home basis. She has to be hospitalized
Admitted
for
in the
a
hospital.
monitoring in the hospital. And then we have to, as I said, the severity. So we have to do all these tests like liver function test, the kidney function test, to look about the severity of the disease and treat accordingly. So mainstay is the antihypertensive treatment, along with that these supportive treatments.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
So why is gestational hypertension considered to be such a cause of concern? You spoke about the impact it has
Yes,
on the
yes.
mother's health. I'm sure the baby in the process is also
Yes,
very
yes,
severely affected by these. So if you could just throw light on what are the health impacts on the child and the mother as well.
Yeah, as I said, hypertension where the BP recordings are high, the blood vessels are affected. So you know blood vessels are everywhere.
Yes.
So it starts affecting each and every body organ of the women. So maybe if you name it, it will be there. So it will affect the retina, she'll get a blurred vision. It will affect the liver, her liver enzymes are more. It will reflect the kidney, affect the kidney, then kidney function tests are abnormal. then all those, then it affects the cerebral vessels, the brain blood vessels, she will throw convulsions. So her morbidity and hospitalization, all these processes and all will increase. The same way as it affects the uterus and the baby also. So it affects the blood supply to the baby from the mother. So what happens, the blood supply is low, so the baby growth inside is reduced. And one more thing is, we do screen for baby well-being also. So if something is problematic inside, if the baby is going for jeopardy inside the uterus, we may have to deliver her early. So the risk of premature delivery is lots in preeclamptic patient or the hypertensive patients. Then with that, as I said, the next time is the abruption. That means the placenta is separated before the baby delivery. So the blood supply to the baby is cut. So the baby can go for mortality, that is baby can lose the life inside the womb. So that is one of the thing. And one more is the oligohydramnios, that is the baby, whatever the water content around the baby. So that is also affected. We know that the water around the baby is like a shock absorbent for the baby, taking out all the stress factors, external stresses. But that reduces, the liquor amount reduces in a hypertensive mother. So all these things will affect the baby. So mainly the prematurity will affect, then the growth restriction we can see in the babies, then the oligohydramnios, and the most catastrophe is the intrauterine fetal demise, that is the death of the baby before birth. So these are the complications we see in the baby also. So that is why we are highly concerned about this disease. Why? Because it affects both mother and the fetus inside.
So you spoke about the health impact that it may have on the baby, but how do you monitor this? Is it through scans, or what are the methods, means and tools that you use to monitor the baby's health?
Yeah, the best mode is the ultrasound, like where we can see the fetal well-being, and the radiologist give us a record of the BPP, that is biophysical profile, how the baby breathing movement is, how the tone of the baby is, and how the liquor, that is the water around the baby is, and how the heartbeat is. So these comes under the biophysical profile. So this is the
this is done through the
ultrasound
scan.
Oh. The one more test we have is the bedside, that is the non-stress test. That is, we see the baby movements in over a 20-minute of period, and the baby is relaxed. If there is like 1 or 2 movements in a 20-minute period, then it is a good reactive one. So this becomes less, and during the hypertensive mother, because it is affecting the baby also. And we also have the Doppler studies, that is the measurement of the blood flow in the uterus, that is how the baby is getting the blood, whether it is fine or it is restricted or it is no blood flow. So these are the Doppler studies. Again, it is additional to the ultrasound only. So the radiologist will help us to know whether the baby is inside is well-being, or it is having something problem, or it has to be delivered soon, or we can still wait for the time.
So doctor, you mentioned about premature delivery as one of the consequences of
yes.
gestational hypertension. So when do you decide that the mother has to undergo C-section and the child has to be, or maybe induced labor?
Yes, yes.
So what is the tipping point that the doctors take the call that it has to be a premature delivery?
So actually, if the hypertension is controlled, well controlled with all the hypertensive medications what we give, so we usually do it 1 or 2 weeks before the due date, that is around 37 to 39 weeks. So we plan for induced vaginal delivery or a C-section if there is indication for C-section only. So as per se, the hypertension is not an indication for C-section, but if there is other obstetric indications, we go ahead with the elective or a planned C-section or a elective induced vaginal delivery. So these will help us to prevent the effect on the baby also, and even the mother from having the complications. So usually at around 37 to 39 weeks we plan the delivery. But if, as I said, the fetal monitoring or the fetal parameters are not going well, or the maternal parameters are not going well, we may have to deliver as early as possible. So, in this cases sometimes we may have to give the mother the antenatal corticosteroids. So, these will help the baby to for the lung maturity. So, if we are delivering the baby less than 36 weeks, so baby will have the lung maturity problem, baby may go for lung problems maturity. So, these will reduce the corticosteroids given to the mother will help the baby's lung to mature earlier. So, this is one of the thing we can take.
And what about the postnatal care? Anything that has to be kept in mind, any additional care that needs to be given to the mothers and the baby also?
Yes, usually 1 to 2 weeks, within 1 to 2 post delivery, the hypertension usually comes down, subsides, and almost it becomes to normotensive. But usually in 20% they will stay for long, maybe up to 6 weeks, 8 weeks, 9 weeks, up to 12 weeks as I said. So, this will take a continuation of the antihypertensive medications, which are both, they are safe even in a breastfed mother.
Okay. There are no side effects.
No
okay.
side effects.
They should continue taking those medications.
Yes, they have to continue, and we will titrate the dose. Maybe she may not need that much which she is taking in the antenatal period. Okay. So, we may have to titrate the dose. So, in the admission before discharge, we will titrate the dose, and we will again send her with the monitoring, with the home monitoring counseling, and along with that again telling her the this thing warning symptoms. So, this is one of the thing, but in 10% they may go for chronic hypertension. So, that is also one of the thing we have to tell. So, ask her not to stop the antihypertensive without a doctor's advice. So, because she may throw convulsions again if she thinks she is normal, because the blood pressure is normal, because she is taking antihypertensives. So, it will take its own course. So, ask her to continue till the probable time where she becomes normotensive completely.
So, it is not advisable to stop the medicines suddenly.
No.
Yeah. So, under doctor's guidance, it has to be tapered.
Yes.
Tapered and then stopped. Okay. So, doctor, before we wrap up, any takeaway message that you would like to share with our viewers about gestational hypertension?
Yeah, definitely. So, the women in Bahrain, I just want to tell you, the regular ANC checkups is very necessary to pick up these high risk pregnancies, one of which is the hypertensive disorders of pregnancy. As you know, there are so many things that affects the mother and the baby in these gestational hypertension or the other hypertensive disorders of pregnancy. So, I always tell them for a regular ANC checkup, and definitely the preventive measures a lot, like low sodium diet, a good vegetarian diet, along with low carb, low fat diet. Trans fat like pizza, the donuts,
junk
foods that they have to reduce a lot, and consumption of alcohol and smoking has to be reduced with a regular physical exercise and definitely a stress free life.
Thank you so much, doctor. Thank you for those reassuring words. So it's good to know that hypertension is something that can be taken care of with medical intervention and a good lifestyle. So there's nothing that the viewers should be extremely concerned about. They just need to keep a check on their body changes and go for regular medical checkups. So thank you so much, doctor, for throwing light on this subject in detail. I appreciate you taking the time out to be with us today. Thank you once again. Thank you. So friends, I hope all of you found this episode very informative. Dr. Deepthi suggested a lot of good points where you can maintain good health during your pregnancy. Pregnancy is a wonderful feeling. Enjoy it, relish it, but do so responsibly, because you are also responsible for the life of your child. So follow a healthy lifestyle, low sodium diet, exercise well, try and be happy, and then you will be assured that you will have a healthy and happy baby. So till we meet again next time, this is Anupama signing off. We'll see you next Tuesday with another topic. Good night, and to all the expectant mothers out there, hope you have a wonderful time and a safe delivery. Thank you and good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.